Hi, I'm Dr. Dean St. Mart, formulator for Supplement Needs, and in this video we're going to cover the CV Stack. So what is the CV Stack? It's an 11 ingredient supplement which has been designed to cater many levels of cardiovascular health. We all know when we look at our blood work, we're mainly looking at lipids within that panel, and that comprises of HDL, high density lipoprotein, LDL, low density lipoprotein, and our triglycerides. We also have within LDL our non-HDL cholesterol, which is composed of ILDL, which is intermediate LDL, and VLDL, which is very low density LDL. And that altogether comprises our lipid panel in blood work. So the CV Stack has been designed to help potentially offset some of the negative effects that enhanced supplementation can have on our blood work. And how it does that is through four separate components. First off, we have a panel that specifically addresses HDL synthesis and supporting that within the liver. For that, we have 500 milligrams of citrus bergamot and 900 milligrams of pantethine. So the citrus bergamot is composed of flavonoids, specifically flavonoids from the bergamot plant, which help to upregulate the synthesis of HDL in our liver. And then pantethine is a coenzyme A precursor, which again feeds into cholesterol synthesis at the very beginning of the manufacturing of it. We then also have a fully comprehensive antioxidant panel. And within that we have 1000 milligrams of olive leaf extract, 400 milligrams of grapeseed extract, 300 milligrams of ECGC, which is the component of green tea, and 4 milligrams or 4000 micrograms of allicin, which is the active component of garlic. Altogether, those antioxidants are there to help offset some of the negatives of arterial inflammation. So not only do we have to consider LDL and HDL synthesis when we look at lipids and cardiovascular disease risk, we also have to consider our antioxidant status within our blood vessels. Are we combating our exposure to oxidants that are residing inside our blood vessel tissues, either from pollution, from the foods we ingest, from a lack of antioxidant intake? So they're there specifically to help offset some of those negatives. Again, more specifically, what can happen is our LDL can get oxidized. So LDL we all view as this bad cholesterol, but it's not really a bad cholesterol. What it does is it's a transport molecule which transports cholesterol throughout the body. That's the key function of LDL. However, other than attaching to LDL receptors and delivering the contents of the LDL to that cell, so for example for cell membrane integrity, there can come a point where that LDL can get oxidized. It can generate small dense particles which can enter into our arteries to generate plaque. That can offset foam cell production, so our white blood cells basically ingest that LDL particle and form what's called a foam cell. And those foam cells all aggregate together to generate a plaque inside the endothelium of our artery, which eventually over time can bulge out and then burst out into the blood vessel, causing a thrombotic event. So we have a blood clot which can then pass to the heart, for example, and cause a heart attack. So it's very important that we supplement our diet with a certain level of antioxidants. Again, that should all be taken care of through your diet. The CV Stack is there to help act as a backup to, again, offset potentially a unbalanced diet. The third aspect of the CV Stack, which I'm very proud of, is the addition of what's called Evnol. This is a patented vitamin E complex specifically composed of tocotrienols. So when we look at vitamin E, it's probably the most important antioxidant in our body. But generally, when we buy a vitamin E supplement, it contains the 4 tocopherols: alpha, beta, delta, and gamma. But those 4 tocopherols aren't as reactive or electron donating as the tocotrienols. So we have 4 tocotrienols and 4 tocopherols. So Evnol composes all 8, and again that's there to donate electrons to oxidants within our body, or free radicals, to help neutralize them from, again, oxidizing our LDL. With that, we then also have 200 milligrams of CoQ10 and 10 milligrams of astaxanthin. Both of them, again, are two very powerful antioxidants, and CoQ10 is involved in a lot of reactions for metabolic health of our cardiac tissue. So again, it's very important that we're keeping on top of CoQ10 intake for cardiovascular health. The last piece of the CV stack is vitamin D3 at 5,000 IUs and vitamin K2. So both of these are involved in calcium transport in the body. Now you might be wondering, why do we want to take care of calcium transport when we're looking at cardiovascular disease risk? Well, calcium is lost from our bones daily. We have this daily loss and daily gain of calcium. However, if that calcium isn't transported correctly throughout the body and is reabsorbed into our blood vessels, it can again form a part of plaque when those foam cells aggregate, like I spoke a minute ago about. So by taking vitamin K2, we're ensuring that when D3 is transporting calcium, it goes back to our bones for bone mineral replenishment. We can check this out, again, here's another nice tip, through doing a calcium score analysis, which is a cardiovascular non-invasive diagnostic tool that looks at how much calcium is spaced throughout your body to give you a certain percentage risk towards maybe having a heart attack from atherosclerosis. So when we look at the overall mechanism of the CV stack, four main things. Increase HDL, increase that good cholesterol transport. Decrease LDL and decrease the synthesis of oxidized LDL. Again, LDL is not the enemy, it's what happens to that LDL, where it gets transported. The third part, vast antioxidant range of ingredients, again to support that arterial health and eliminate oxidants from it, again oxidizing that LDL particle. And then the fourth, supporting bone mineral health to again stop calcium absorption into our arteries. Now to just round us up, like I said, small dense LDL is what we're trying to avoid here. Now there is a genetic aspect to this, which we can do further diagnostic blood tests to see what's the ratio of large to small LDL particles. If you can imagine, a small dense LDL particle would be like we have a hole in a wall. If we throw a football at the wall, it bounces off and bounces back. But if that hole is small enough and we throw a marble at it, it can pass right through that hole. So if we think about the endothelium of our blood vessels, it's only one cell layer thick. So it's very easy for a small molecule to pass through. So that's why it is important that we keep on top of, again, supporting our antioxidant status within the arteries. One final thing, and again we stock this in Supplement Needs, it's called a Pauling therapy, and that composes of 5 grams of lysine and 5 grams of vitamin C. It was originally developed by Dr. Linus Pauling, who's a Nobel Prize winning physicist. His views on this subject was that our LDL receptors in our body have lysine residues. So if we do simple displacement chemistry, which is basically we flood the body with an external source of lysine that attaches to the blood vessel instead of the LDL molecule. That allows the LDL molecule now to pass back to the liver, be recycled and then excreted from the body. The vitamin C then is there again as an antioxidant, an electron donor. And that's why it's important again for vitamin E, because vitamin E actually gets replenished by vitamin C. So if that's something you're interested in, 5 grams of lysine, 5 grams of vitamin C before bedtime should help to reduce LDL elimination from our body. So I hope you've taken some great tips from the video. That's the CV stack. I'm Dr. Dean St. Mart, formulator for Supplement Needs, and thank you for listening.